This is Dr. Meyer, a pulmonologist in Carmichael near Sacramento, California. Last week we talked about some of the problems with blood pressure and how to measure it and stay on top of it. We'd like to go a little bit further into the item today and talk about the treatment of high blood pressure. Healthy diet is very important, and the treatment meshes with prevention. So it's really the same issues, the same type of lifestyle and following healthy eating patterns, reducing the salt and sodium in your diet. That's very important, and really have to read the labels when you purchase food and go grocery shopping. And a lot of your fixed meats and cheese contain very high amounts of sodium. And a lot of the prepared soups have high sodium. I remember one patient who just couldn't avoid soups, and he went to Tahoe frequently and he enjoyed that, and he had the buffet dinner before he came back on Sunday, and he'd go into heart failure about halfway down, and he'd go directly to the hospital. And became apparent after a couple of visits that he was eating like tomato soup, which has about 2,000 milligrams of sodium in one serving. And so you have to really be careful and watch your weight gain sometimes by the sodium you eat. Most of us maybe gain several pounds of water after going to a Chinese or a Japanese restaurant. And so we can just check that on our feet, you know, and I can kind of check that right here, and you can see that I've got a fair amount of water here, but I'll be gone tomorrow morning. That's of no concern. I'm not going to take water pills just to get rid of that because the kidneys are a little bit behind right now. But that will all be avoided out by tomorrow morning. In addition to the diet, reducing sodium and taking a lot of potassium every day in healthy fruits. One question is alcohol intake, and people say, well, alcohol relaxes me, but the point is alcohol, after the basics, increases your pressure also. You have to remember that a drink is a drink. 12 ounces of beer, 5 ounces of wine, and 1.5 ounces of whiskey all have between 100 and 150 calories in it. And the limit of that would be basically 1 drink per day for women, unless they're large, and 2 drinks for men. And I think if you had your driver's license recently taken or took a test, you'll see that that's exactly what it is on your weight basis, whether how much alcohol can you drink before your alcohol level gets in the illegal range. And in California that's very important. I think when you get the second ticket, you might end up in Folsom State Prison. The other thing is on tobacco. Does tobacco cause high blood pressure? Basically, tobacco itself won't cause high blood pressure, but the point is it causes early aging of the arteries and causes coronary artery disease, causes heart disease, and eventually you'll have all kinds of vascular problems. So you have to be very careful on that. Basically, it's healthy eating, keeping things going, and there is a program called DASH, which is, you can get it on your website, DASH, and goes into how to prevent sodium from being used. There's various types of blood pressure medications, and basically we can group them into 4 groups. And it's been pretty well standardized, and so there isn't a whole lot of variation. I think the Kaiser system uses diuretics first. Most of us maybe use it second, or maybe even third. We've seen in many cases it may cause a little pre-renal azotemia, which is not a good thing and causes more swelling of your ankles. And so in most cases a ACE inhibitor is the first medication. And to look at the 4 groups, the diuretics, ACE inhibitor, beta blockers, calcium channel blockers, and angiotensin reuptake inhibitors, ARIs. The first one would usually be the ACE inhibitor like lisinopril. Now these have been around for a long time. You can use a modern one, or you can go and use lisinopril and those basics that are very old. You get them for $4 a month at the discount houses, whether it's Costco or Sam's Club or Walmart or Target, or $10 for 3 months supply. And then you have the beta blockers. These are also long-time drugs, and there's a number of those that are very cheap, inexpensive, been around for a long time. And I certainly get mine for $4 a month or $10 for 3 months supply, like Tenolol and others. And those are the two basic ones. Most people can be managed on those two. Then one can go into adding the diuretics or calcium channel blockers or the ARBs, and most people are on 2 or 3 of those. When you're on several of those, then it's important to measure your blood pressure morning and evening until things are very well regulated. And I normally have people take the ACE inhibitors in the morning and the beta blockers in the evening. The reason for that is the beta blockers sometimes lower your blood pressure when you get up suddenly, and so I wouldn't take a beta blockers like on Saturday morning if I'm going to be climbing a ladder, because you don't want to get dizzy going up a ladder. And so there's many things to watch for that, and your doctor can help you out on that. So these are some of the questions you may want to ask your doctor to go over. And so it's very important to measure your blood pressure, take things appropriately so you have round-the-clock coverage, so you don't have to escape because you're on 2 medications. Some of them may last 12 to 18 hours, others may last 18 to 24 hours, and so you don't want to have escape. You certainly do not want to take 3 different blood pressure pills at the same time of day, and they all wear off after 18 hours, and you have a very high peak at the end of that time. Because I certainly don't want to have a stroke, and I hope you don't either. So that's it for today, and thank you for watching, and be sure to follow these YouTubers on our website, delmeyer.net.